welcome to the Art of Being Human. Now, I've been dealing with chronic illnesses these last few segments. In fact, for quite a while I've been dealing with it because I really believe that a lot of people have chronic illnesses, and it does affect your personality. It affects how you feel about yourself. It affects how you feel about your life and other people and other situations. And so we've been dealing with diabetes, and I'm going to continue with that today. Diabetes, as you know, is a very serious illness, and it's an illness that millions of people have. A lot of people don't even know they have it. When my father had it, we didn't know he had it till he collapsed on the floor. He was unconscious. He'd gone into a coma. My brother scooped him up and carried him to the hospital because we were very close to a hospital at that time. And that's the first we knew that he had diabetes, but it shouldn't have been unexpected because there were relatives on his side of the family that had lost limbs due to diabetes. And when you first know that you have it, when you've first been diagnosed, it takes quite a while to adjust to the fact that you have it. But I want to go into it. I am diabetic myself, and so some of the things that I say here reflect upon my own experiences with it. I've been diabetic for probably 24, 25 years, around there somewhere, and I've been through the mill with it, and I've had all kinds of tests and gone through surgeries and done all kinds of things. And so when I say some of the things I talk to you about, it's a reflection of what's happening to me. Now, I don't approach this show as a venue to talk about myself, but I do it because I understand what the process is like, what happens when you have diabetes, what you go through, how difficult it is, and the fact that it's a lifelong difficulty and you live with it for the rest of your life. So I'm going on with that. If you have a diabetes, you will understand that it affects every single organ of your body. Every organ is affected somehow, and it means that you have to put yourself under care. Different physicians, different techniques of healing, all of the things that you have to do in order to keep yourself healthy, nutritionists, eye doctors, foot doctors. So I made a list, just in terms of myself here, of what kind of care that I have received. What kind of specialist do I see? Well, I have a primary care doctor. Everybody does, I think. I have a diabetic specialist, a foot doctor, an eye doctor, actually two doctors. I have an ophthalmologist and I have an optometrist. There is a difference between them. An ophthalmologist is a medical doctor who has gone on and studied problems with the eye. The optometrist is a doctor of the eye, but they're not an MD. They don't have to get an MD degree first. But they're both very good. They're both very skilled. And I know when I was going to my optometrist, if there was any little thing out of the way, he used to automatically refer me back to my ophthalmologist, and they work together. It is not uncommon, and actually it's a good idea, to have 2 or 3 specialists in a certain area so they can confer back and forth about what's going on with you, and you can get the best quality care. I also have a skin doctor, a vascular surgeon, a dentist, because believe it or not, diabetes does affect your mouth health and does affect your teeth, a neurologist, because I've had a stroke related to the diabetes, a nutritionist, a diabetic educator. Now, I don't see all of these specialists all the time, but they're all basically on a team. And if you are diabetic and you read literature about it, they will say that you are going to assemble a health care team. And this is the team that takes care of you as a diabetic. Do I like going to all of these doctors? No. Fortunately for me, I have very good doctors, and I stay with them because they have been very good for me, and they've really helped me a whole lot. Well, if you are diabetic, then you will be going through various procedures, various medical procedures. So I listed down some of the things that I've gone through. I had a quadruple bypass surgery. That's not a walk in the park. A nuclear stress test, where they actually stress the heart and give you symptoms of a heart attack so they can see how your heart is reacting to it. Not too much fun. Then I had regular stress tests. I had MRIs. And they had an attempted stent surgery that failed. I have had ultrasounds, CAT scans, so many that I'm now allergic to the contrast dye in the CAT scans, various foot procedures. I've had cataract surgery. I've had laser surgery on my eyes. And I am too high. I'm supposed to have another surgery, which they're going to postpone because they think that the risk is too high. That would be from the vascular surgeon. So that's all the things that I've gone through. Every 2 or 3 months, a different test. Every 2 or 3 months, some kind of a scan. And it's like this all the time. Well, you know, after a while you get sick of it and you think, how much more of this have I got to go? But you've got to remember diabetes is lifelong, and it's also a creeping illness. When I first got diagnosed, there was a pastor who came to me in the denomination I was in then, and he said, be careful, Pat, this is a creeping illness. It gets worse with time, and it does, and it gets harder to control with time. So that means that all of the time that you're diabetic, that occupies a good part of your life, taking care of it, making sure you have what you need, making sure you see your doctors on a regular basis, making sure that you go through the tests that they want you to go through. And so what do I take with me? This I just wrote down as a curiosity, because if you're traveling a lot, I do travel a lot, think of all the things that you have to carry with you if you're diabetic. Well, I have to have the blood glucose meter. I have to have my test strips. I have 2 types of insulin I take, so I have to have enough of that. You have to always have snacks with you. I was told early on when I became diabetic, always carry food with you. Candy, crackers, peanut butter, because you can crash, and if you do, you're in real trouble. If you don't have something to lift up your blood sugar, you can eventually just go into a coma. I always have a sugary drink, glucose tablets, syringes so I can take the insulin. They want you to wear a medic alert bracelet or a pendant. Then if it's hot, you have to take ice packs to hold everything together. And your daily routine is many times based upon your illness as well. Just to get up in the morning, I have to get up, do the usual things when you get up. I'm not going to go over that, but always I have to check the blood sugar. I have to take my medications. In the morning I take 6 pills. I take 3 at night. I have to take pills that have to do with blood thinning, heart pills, blood pressure pills, cholesterol pills, vitamin pills, and I have a vasodilator that I take to increase the size of the blood vessels to get less angina than you would get if you don't have it. Then you're supposed to wear a diabetic bracelet. I have to check the blood sugar before I drive if I'm going any kind of a distance at all. Now, does that make you discouraged? Well, I'm not discouraged because I lead a good, healthy life. I'm very busy. My doctors tell me that my busyness, my schedule is much greater than most people my age, even though I have this chronic illness. So you do not have to let diabetes stop you from living a normal life. It does interfere. You're constantly checking. You're constantly doing things to manage it. But if you do all of that and you're faithful with that, you can live a good, healthy life. It's inconvenient, but that's just the way it is. I am concerned, however, about the expense of it. I'm having help with that, so it's not so much a problem with me, but many people just can't afford the medication, can't afford the insulin. I take 2 types of insulin, and to me, I lay this down as an example of greed. A little vial of insulin, this big, costing $160, and it only lasts for 10 days. Another form of insulin with even a smaller vial lasts for about 10 days, $150. So when the Obamacare came in and we were supposed to be able to get medication for a much cheaper price, what did they do? They increased the price of the insulin. And they can get it because you have to have it. If you don't have it, you'll get serious complications and you may not live very long, especially with type 1s, but also with type 2s. So the expense of it is enormous, and I don't see any sense of it. And and I get angry about it. Now, it used to be one of my diabetic doctors would give me samples of insulin, and he did it for all of his patients to cut down on their expenses. Now hospitals have become hospital corporations. They're no longer able to help their patients. They're not allowed to give out samples of medications. So these poor elderly people who are living only on Social Security and they don't get any help are just deciding, do you buy the insulin or do you buy food? And with a diabetic, it's critical. You've got to have both because one has to balance out the other. So I do have a concern and also a fair amount of anger at what I consider to be the greed of drug companies making money over hands and fists and saying, well, we need it because we have to diagnose new and we have to develop new medications for illnesses. And I get that. But it's not going to do any good if people can't afford to buy it. So that is a problem I think we have to deal with as a society, making sure people get the medication that they need. So let's go on to this. This is what people do when they find out that they're diabetic. There is an adjustment period, quite a long adjustment period. When you find out you've got it, what you usually do is deny it. Or when you finally get used to the fact that you have it, you usually say something like, well, I got it a little bit, but I feel pretty good. I don't have it that much. But it's like pregnancy. You either have it or you don't. And if you are, you are. And you have to face the fact of that. So this is what I wrote here on the charts. The medical tests and how often. How often do you get checked? Well, usually you have a checkup every 3 months with your doctor, your primary care. And the blood tests every 3 to 6 months. The A1C test, I am going to explain later on what that is and what that does. It's very important, and most people get checked with an A1C from anywhere from 3 to 6 months. And there's a reason for that. The kidney tests every year, cholesterol tests every year, eye tests every year, sometimes more often if you have an eye problem, foot tests once a year or more often, and you have to check, this is the average, sometimes you have to check more frequently with your doctor, depending upon what your condition is. Usually you see your nutritionist 2 or 3 times a year, but that's occasionally. Okay, the medical specialists that help with diabetic care, your physician, which would be an MD or a DO. A DO is a doctor of osteopathy. They're excellent, both of them. Nurse educators, that would be an RN. Dietitians, RD would be the registered dietitian. CDE stands for Certified Diabetic Educator. They're very, very helpful in your care. They help you to understand the illness. They help you to manage it. The ophthalmologist is the eye doctor. He has an MD first. The optometrist is an eye doctor that does not have an MD, so therefore they're not doing surgery. Mental health care professionals such as psychiatry, psychologists, social worker. And in case you didn't know, the psychiatrist has an MD degree before they study psychiatry, so they're all medical doctors. The psychologists do a lot with mental illness. They do not have an MD degree. Social workers, then you have exercise specialists because you need to exercise. That's really something that's important. And your pharmacists. Nobody knows more about medication than a pharmacist. They're a wonderful source of information. Now let's move on to type 2. Some of this will be a little bit of a review. Most people who are diabetic are really type 2. They do produce insulin. I was told I would always produce insulin, but the insulin is very little, or the quality of it is so poor that your body can't use it. And eventually, most type 2s use insulin. It used to be thought, and I've been told I don't know how many times, well, you're lucky if you have type 2, you'll never use insulin. Not true. This is a creeping disease. It gets worse and worse. And usually they like to start out by working with diet and exercise. That does work for some people. And then they go on and you take medications. I'm going to go over the medications this morning. And then if when that stops working, then you move to the insulin phase. And as you progress in this illness, you end up by taking more and more insulin as time goes on. Okay, so sometimes your cells will resist insulin, and you need more and more insulin to overcome the cell resistance. And this is where exercise can be a help, because it helps the cells to be able to accept the insulin and they're not so resistant. Now, some medications can help the cells to be less resistant as well. We're going to go into those medications. There are different ways you can get diabetes. I think most of it is genetic. I think most of it is family-oriented. It's familial. You get it because your father had it. If your parents are diabetic, then especially your father, there's a 50% chance that you will be too. That's kind of a rule of thumb. It doesn't mean that you absolutely will be, but there's a good chance that you will be. Now, some people get the flu, and it settles in the pancreas and it kills off the beta cells. The beta cells in the pancreas are the ones that produce insulin, and then you will become a diabetic. And by the way, there are some medications that cause diabetes that just destroys the insulin in your system, destroys your pancreas. So even some medications can cause diabetes. With type 2, there's some insulin, less and less over time. Sometimes the elderly get it simply because their bodies are not working. There is a thing called homeostasis, and with homeostasis, what happens is that your body is supposed to be working together. The organs in the body are supposed to be working together in a balance, like in a harmony. But as you get older, that homeostasis starts to leave because your bodies just don't work the same way. And as a result of that, you can get illnesses simply because the body kind of loses touch. It changes in the way that it functions. So that's another cause of type 2. Diabetes can be caused by illnesses, like I mentioned before, and medication that affect the glucose production. It destroys the beta cells that produce the insulin. There's lots of ways to become diabetic. My father was adult onset, so I suppose he was considered to be type 2, but he was immediately put on insulin. And now I believe the prevailing thought is you can get type 1 at any age. They used to consider type 1 as juvenile. In other words, you were born with it, your pancreas never produced insulin, and in type 1, your pancreas does not produce insulin. Type 2, it produces some. But now it's thought that type 1s can be found at any age, although more so in younger than older. My father immediately was put on insulin because he collapsed and he was insulin dependent for the rest of his life. Let's see, borderline diabetes. This term is not used much anymore. Borderline diabetes is when you're on the border. You have it maybe, not quite. You're getting up there. Your blood sugar is too high, but even though it's too high, you're not quite considered to be diabetic. Well, scratch that. You have it or you don't have it. I don't believe there's any such thing as borderline, but there is something called prediabetes, when your blood sugar is getting up, maybe not high enough to use insulin, but getting real close to it. That's prediabetes. And then usually you just go over the line and become diabetic. Now, the basic facts as to how this works. You eat food. This is how the digestive processes go. You eat food, it digests, and it becomes glucose, which is a kind of sugar. And then it goes into the bloodstream, and insulin will take that glucose and move it into the cells for nutrition and for energy. But in the diabetic, you don't have the insulin to move it into the cells, so it stays in your bloodstream, and your blood sugar gets higher and higher and higher. And what happens is that it gets sticky, it's too high, it attaches to the organs, it attaches to the nerves. There are all kinds of complications as a result of that, and that's where you get your complications and you become very ill. And the results, you have symptoms of thirst because the cells are starved starving, hunger because they're not getting the nutrition they need. You're tired and have a lack of energy because there's a lack of glucose in the cells. Where is it? It's in the bloodstream where it shouldn't be. And then you have excessive urination because the body is trying to get that sugar out of the system, and you do it by being in the bathroom a lot. And in type 1, the body does not make insulin, and our immune system sometimes, it can be an autoimmune disease. I want to just mention this, and then I'll close with this because we're running out of time. But in an autoimmune disease, your immune system is causing you to be ill because it's attacking something in your system. So in a sense, you're kind of like allergic to yourself. Well, sometimes we consider diabetes to be an autoimmune disease because you are developing a way that your blood cells are killing off the beta cells in the pancreas. So you are killing, in a sense, your own cells that produce the insulin. And so you can get diabetes from that. And that's probably the cause of a lot of type 1s. And probably the cause of a lot of type 2s, too. So I'm going to close it here because we're pretty much out of time. And I'm going to start off next time and talk about the treatment, including the pills, the insulin, and we'll go on with it in terms of that. So please join me next time.